The secret of getting ahead is getting started. Mark Twain. Welcome to Living at Your Finest podcast. I'm your host, Dr. Babs. I'm a triple board certified family, obesity, and lifestyle medicine physician, and I am the founder of Living at Your Finest Wellness, a holistic direct primary care practice. Did you know that 80% of lifestyle-related chronic diseases within our communities are preventable, with poor diet being the primary culprit? Now, contrary to what we thought, that it was our unfortunate genes, the good news is that we can make changes together to improve our health and quality of life. So that's what this podcast is all about. The Living at Your Finest podcast is devoted to helping families to live at their finest well-being using a holistic approach with a healthy lifestyle to nourish and flourish as a whole, vibrant, and healthy champion. So join me and my guests as we share transformational and sustainable skill sets from our health and wellness journey to support you and your families in achieving optimal well-being. Ready to live at your finest? Well, let's get to it. Hello, everyone, health champions. Welcome back to Living at Your Finest podcast show. Thank you for showing up once again. I hope you are all doing well. I am truly honored today because I have an amazing colleague with me. She is lifestyle, obesity, internal medicine, and passionate about weight management and weight care. So there's a lot of nuggets that are going to be dropped today. So this is one episode you want to share with others. And, I'm just really pleased and honored that she's here today. We're going to be diving into weight loss and GLPs. How do they work? I know this is a question that comes up quite a bit. And since we're in this field of educating our patients, I think it'll be important to have this conversation. We're going to dive into how GLP works, what they are, who is a good candidate for it, and is it fix-all solution, right? But before we get started, I want to give just a brief introduction. So Dr. Meghan Garcia-Webb is a physician focused on weight medicine. As I mentioned, she's triple board certified, as I am as well. The only difference between us is that I'm family and she's internal medicine. So warm welcome to you, Dr. Garcia-Webb, to the Living at Your Finest podcast show.
Thank you so much for having me. I'm so excited to be here and I love talking about this. So thank you for having me on.
Yes, the pleasure is all mine. And, I'm always excited when I have a fellow colleague that is passionate about weight management and just educating the community. So I love to learn more about how this all started for you. Where, we weren't taught in medical school, right? We all know that we barely got an hour or two of lessons around weight management and nutrition. But if you can start by just sharing where that journey began for you, why are you passionate about this field?
Absolutely. So I finished medical school and I wanted to go into internal medicine. I really love all the systems, as I'm sure you can appreciate as well. And I decided to go into primary care because I wanted to keep people out of the hospital, not treat people in the hospital. And so that was always my goal of helping people remain healthy and happy and out of the hospital as much as possible. And I just started noticing that I was having the same conversations with people over and over and over. And, we'd go over all the plans for because a lot of their medical issues were so tied to their lifestyle. And so after a while, it just seemed like everybody had the information, but it was really about getting them to take action. And that was the real issue. And so I did my boards in obesity medicine, but I also got certified as a life coach. And I felt like that both of those together were really the missing piece in terms of how I could best help my patient, because having knowledge and better access to these medications was so important, but also just the whole mindset shift that's really required to help people make change. That was one thing that we definitely weren't able to spend a lot of time on in medical school. There's so much to learn, right? But I felt like that I could really connect with people in a different way that was very, very helpful for them.
Yes, and I think it was so important that you mentioned that to be able to connect with patients and have meaningful conversations, right? You can't do that in a 10 minutes and 15 minutes. And so I love that you also became a life coach. You learned how you learned the knowledge part of it, but also how do you apply it to the patient right in front of you. So yeah, that's great. So can you tell us more about the GLPs? I mean, everyone is talking about them. There's a lot of controversy out there. I know that it's evidence-based, right? I use them in my practice, but can you share what they are for people, listeners out there, and what will be considered the best practices around using the GLPs?
Sure. Yes. I mean, these are really such powerful tools that we have that, we've had for diabetes for many, many years, but it wasn't until the last decade that we realized, oh, actually, these could be useful for weight loss as well. So I think people hear it and they think, oh, this is a new medication. And some of them are newer drugs, but as a class, it's actually not new at all. So I think that's somewhat reassuring to patients. But they work in a couple different ways, and that's what makes them so powerful, is that they work not only to slow the movement of food through the stomach so that that fullness signal is really strengthened from the stomach to the brain, that a lot of people are used to ignoring, and they can't ignore it anymore when they're on this medication. But it also works, we think it works in the brain itself to help just turn that internal thermostat down a little bit, so it makes it easier for patients to lose an extra 10 to 20% of their body weight. And that's really helpful also in terms of, patients who are on medications that can induce weight gain. I feel like it's a really powerful tool to help with that. And then the third way it seems to work is, for some people, it really helps with that reward system and that whole idea of food as entertainment. It seems to really turn the volume down on that for a lot of people. So people have probably heard in the news about food noise or cravings or things like that, and they don't really get it until they go on the medication, and then they have all this mental clarity and space that they didn't really have before because they were thinking about food all the time. So yeah, I think they're wonderful.
Yes, I agree. And it's a real thing. People don't understand. For those that are critics, they feel like, yeah, just diet and exercise, right? Eat less, right? Or move more. It's more than that. The food noise is a real thing. I had a patient just last week. He was exercising, doing all the things, but he couldn't stop thinking about food. There was always that. And the moment he was on the medication, he said, he can control. And to your point, the mental clarity, you're not thinking every second about food. And yeah, that's the evidence behind it. So who would be a good candidate then? You have your practice, they come to you. What's the approach that you go through to assess a patient's need for the medication?
Sure, that's such a great question. So, the first is there are some pretty clear BMI cutoffs for patients in terms of who would be appropriate or not. So, the first is looking at somebody's BMI, and to qualify, they have to have a BMI of 30 or above, or 27 and above with a weight related medical issue, whether that's sleep apnea or hypertension or prediabetes or high cholesterol. There's so many weight related issues, but 27 and above with at least one issue. And then I think there's a couple different patterns I see for people who are really great candidates. I think the first category is people who, they're in that they fit the BMI criteria, but also they've been doing all the right things, quote unquote. They've been working out, they've been watching what they're eating, and they just can't really move the needle despite all their best efforts. And I think for those people, this is a really great tool to just help them go that extra distance in a way that they've kind of done all that they can do. And so it's a really great next step for them in terms of getting their weight to a healthier place. So I think, to your point, there are those people that they're just doing all the right things and things aren't moving in the right direction. And then I think there's another category of people who, they're really not doing all the right things, quote unquote right things, but they're just tired of trying. They're sort of mentally exhausted. Maybe they've been doing this since they were 10 or 12. They've just been in this sort of diet mindset, or they've tried so many things, and maybe they lost weight but then it came back on, and I feel like they're kind of in a place where they're a little bit hopeless, and it's very hard for them to invest in one more exercise program or one more eating program because they just don't really see the point, because everything hasn't worked for them before. So I think for some people, starting on the medication first is really helpful, not only for their weight to get them to a healthier place, but also just to give them that hope back of, oh, you know what? now that I see that things are moving and I can sort of, I have these guardrails up now with the medication, that I really can start to invest
Mhm.
in these other ways of these other lifestyle ways of being healthy. So I think that's a second category. And then the third category, which I've just seen more and more, and I don't know if you've had the same experiences, just people with medication induced weight gain. I see that so much for especially women who maybe postpartum or during menopause, they were started on a medication like and if this isn't all women
Yeah.
or everybody on these medications, but a lot of times people are started on, an SSRI or an SNRI or something like gabapentin to help with sleep. And it's a very insidious weight creep, and they don't really notice it until 2 or 3 years later. And they're like, where did this 20 pounds come from? Right. And so I think for those people, they could do all the right things and they may not see the same effect as somebody who wasn't on those medications. And so these medications are a really helpful way to combat that.
Yes. Well, thank you. That's comprehensive. I love, not only did you emphasize the BMI criteria, right, which we know is documented as a support for the medication, but that's why what you do and what I do is so unique, because it's patient-centered. It's the person in front of you. It's taking that deep dive history to understand the dynamics of the patient. And that's where all the other patients will fall in, like the medication-induced weight gain, and also that person that is frustrated. I know I had a mid-age patient said, never in my life have I felt this healthy, because they were on the weight loss medication and their numbers had improved, their health markers, their triglycerides, their numbers, and that person had hope again. Just gave me chills when you were referring to that particular criteria, group of people that have done everything and they don't have any energy or anything left in them, and they just want something that has been proven to work, through the evidence. So thank you for being very comprehensive with the group of people that can be a good candidate. So I guess the flip side of that will be, what are some of those contraindications? Because I know that comes up quite a bit, and I'm sure you get asked that question too in your practice. Especially, since we have Dr. Google everywhere, patients are asking those questions, and even those that are good candidates are also fearful of some of the side effects. So can you share a little bit more about what that looks like in your practice? How do you handle that? How do you relay the information to patients in terms of those that are not good candidates, and what are
Right.
the alternatives for them?
Right. Yeah. So I always start with, the rare scary side effects and then the more common side
Mhm.
effects that, most people tend to experience. So the rare scary side effects would be like, medullary thyroid carcinoma or multiple endocrine neoplasia type 2, which is a very specific type of genetic thyroid cancer. Wouldn't be a good fit for somebody who had that in their family or personal history. I always warn people that when you lose weight in any particular manner, if it's quicker, you're more prone to make gallstones. So, and that's either, surgery, lifestyle, or medication. So your gallbladder is always a little bit at risk. So it could be some collateral damage. So I always like to give people a heads up about that. History of pancreatitis, probably not a great fit because it can cause pancreatitis rarely. Every once in a while, somebody does have a mood issue. I tell patients, most people, their moods get a lot better. They're feeling better. They can do more, but every once in a while, somebody feels a little off. And then, of course, there are the eye issues that we're just learning about. So I always tell people if they have a lot of eye issues, talk to their ophthalmologist first, make sure they're okay with it, and definitely let me know if you have any eye issues that come up. And then there are the other things like, constipation, diarrhea, nausea, vomiting. I think, there's so much in the media about gastroparesis and small bowel obstructions. And I say to patients, like, those are real things, but those are end stage complications of these, annoying commonplace side effects. And so you really should be, in most cases, you should be able to catch that before it gets to that stage. And I always want patients to tell me, like, if they're having a bowel movement every day and now it's, don't call me if it's been 10 days, call me if it's been, a couple days. But if they notice that things are really getting uncomfortable for them, there's a lot of things that we can do so that they don't end up in one of those situations. And then the other thing people ask me about all the time, and I'm sure you get asked about this too, is the muscle loss.
Oh, yeah.
And I I just think that is so blown out of proportion in the
Mhm.
media. I really find, yes, protein is important. Yes, it's important to work out. It's important to strength train, but I'm really not having anybody come in to my clinic with severe muscle wasting. Like if anything, and I give this to patients in their 70s and their 80s, and I'm, always on the lookout for that. But I think for most people, it just enables them to do more. So if anything, they're more able to build muscle. So I think it's important to look out for, but I think the way it's presented in the media is not what's showing up, at least for me, in everyday
Mhm.
life.
Yeah, I mean, you hear about the Ozempic butt, the Ozempic face, all of those things are scary. There are pictures out there. But yeah, but I guess that's why we monitor our patients closely. We provide anticipatory guidelines, what to do in terms of protein, strength training, and close monitoring. And I think that in my experience, I have an in-body scan, which I use to
Oh, I
track
love
when
that.
patients come. Yeah. So I just tell them you really have to be intentional about eating because you might not gonna feel like eating, but you do want to eat. But when you're eating nutrient dense foods
Mhm.
so that but to your point, I haven't had that experience either, that severe muscle wasting that you hear out on social media. But I also like what you shared about not waiting till when they haven't moved their bowels in 10 days before reaching out to you. All those big complications and scary ones that we hear, they don't just happen overnight. So it's, a lot of times I think people feel like it just happens, gastroparesis just happens. It's a gradual
Right.
thing. And so that's why for listeners, you have to make sure that you are working with a certified physician like myself and Dr. Webb, not just anyone that's just giving you a prescription. You really need to have that sit down conversation about the best practices around the use of medication. Thank you so much for joining me on this week's episode. My goal on this podcast is to empower, educate, and encourage you to take actionable steps to triumph at living at your finest, body, mind, and spirit. Of note, the information provided here is for educational purposes only and does not substitute as medical advice. Please discuss your healthcare needs with your licensed medical professional. If you are in need of a compassionate and comprehensive holistic physician or know someone who is, please reach out through my website, livewellness.com, for a meet and greet. It will be my honor to talk to you. Are we connected on social media yet? I share more in-depth content on best practices to ensure that you live at your finest daily. So please join me on Facebook, Instagram, YouTube at Living at Your Finest Wellness, where we can learn together and stay connected. Lastly, please subscribe to iTunes if you have not done so already and share the podcast within your circle of influence. An extra step? Leave a review and let me know what topics or discussions you would like to hear more of. Thanks in advance. It is always a thing of joy to hear from you. Now, let's get back to today's episode. All right. So I have just one more question for you, if you don't mind, Dr. Webb, before we shift gears and learn about who you are as a person and learn about where we can, take advantage of your services. You mentioned that, the GLPs are not, a quick fix for everything. Can you share a little bit more about that? What do you mean by that? And what would you like our listeners to know about that?
Yeah, I think it's really important for people to know that, right now we want to think of these medications as forever medications, in that it's not something you're going to go on for 3 months or 6 months and then taper off of. Nothing bad happens if you stop them, but they do stop working. So, in the same ways we wouldn't expect, 6 months at the gym to last you for 3 years, we also wouldn't expect these medications to continue to work after you stop using them. So, I always want people to be in the right frame of mind in terms of I'm okay with taking a medication forever, with the goal that, we're also preventing other things from happening, that these weight related medical issues that can just get worse with time. So that's the first thing I want people to know. And then also that the medications do a lot, but they don't do everything. So I just want people to get the most out of these medications because, as you know, they're hard to get, they're hard to keep with insurance sometimes. There's just some people, so many people are paying out of pocket. And I really just want everybody ready to get every last benefit out of them. And so you certainly, as a patient, you could take it and do nothing else, and you're probably going to lose weight, but you're not going to be getting the full benefit of the medication. And so really those lifestyle changes are not, they're a must either way, whether you're on a medication, whether you're not on a medication. They really not only help you get the best results, but the medication's not going to help your cardiovascular fitness, right? It's not going to help you lift more weights at the gym. There's so much that it can't do. And so I think I want people to just realize that there's no way around these other principles, these like healthy boring principles that are so important, that it just works well with the medication.
Yeah, absolutely. So it's a multifactorial, right? So it's not just the medication solo, it's a combination of the lifestyle habits that will supplement and complement the use of the medications. And even more so now, yeah, to your point, for the first thing that you said, it's so important because, again, as much as we know, yes, the medications should be used long term, but if for any reason there's a supply issue or you can't afford it, you definitely need to hone in those lifestyle skills, because the weight will come back. If stop whatever it is that was helping you lose weight and you didn't master other skills, there's that tendency to gain back the weight again. So I think that's very important what you said, that you need to apply that multifactorial approach. So that is great. Well, are you ready for us to go to our question drill?
Yeah.
We learned
Yes,
who you are.
absolutely.
So yeah. So my first question is tailored around the name of the podcast. It's called Living at Your Finest. So we would like to hear from you. What are some things that you do, one or two things that you do that helps you live at your finest well-being?
One thing that I do is I always stop eating when I'm full.
Okay,
I
cool.
feel like nobody knows how to do that anymore. It's how kids eat. And
Mm,
then as we get older, we really lose touch with that. And I think if we all were able to stop eating when we were physically full, like that's kind of 90% of the battle right there. So, but it also depends on, there's, if we're eating foods that are more processed, they're going to kind of bypass a lot of those signals. People eat really quickly, so we don't give ourselves enough time. Distracted eating. So I never eat distracted. I always eat, sitting down.
fantastic.
Yeah, I feel like I have
You
to,
never eat in your car?
I never eat in my car.
Wow.
I really feel like I have to practice what I preach. And so
Fantastic.
I always do that. And then I go for a walk 6 days a week. It's not always a long walk, and I don't really consider it part of my regular exercise, but I think it's really good for mental health. I also feel like, again, as a physician, it's important for me to do that most days of the week. So when people, because I'm in Boston, when patients tell me, well, I couldn't exercise because it was cold, I can say, well, I was just outside. What do you mean? Do we not have jackets? Like, do we not have gloves? What's going on? Right. So,
Oh, that's so good. Thank you for sharing that. But that I admire that you do your best not to be distracted when you eat. You eat when you're not completely full. About 80% full is what you're saying. Because there's that delay in signal. You know that, right? There's that, I think it's 15 minutes. I'm trying to remember how long the brain, by the time you're eating and eating, especially eating fast, that you miss that fullness signal. But if you have already trained yourself to eat when you're in tune with your hunger cues. That's good. That's very good.
yeah, I do. For me now, it's hard for me to think of how do people stop eating if they're not doing that. Like, it's so automatic for me. And I just want to teach everybody else as much as they can.
Yeah, yeah,
And that's another great reason. That's another great reason that these medications work so well, because the signal's so much stronger that
yeah.
people can't ignore it anymore.
Yeah, very good. All right. Well, next question that I have for you is, what is one thing that you would share with your older self in terms of, maybe 20, 30 years from now that you're most proud of?
Oh, that I'm most proud of. To tell my older self that I was okay with a very non-linear path. I think a lot of people go into medicine right out. I think, and you are maybe one of these people who are like knew right when you were young and you went right to school and you
I
knew what
knew
you
at 5 years old that I wanted to be a doctor.
right, you knew at 5 and I did not know. And so I guess I'm proud of being mentally flexible
Mm,
and just kind of letting things unfold because I really feel like all the things that I did in the past before medical school actually kind of came back around to help me now. So,
right. Very good. Very good. Well, thank you for giving us that opportunity to go into your world and just know who you are as, of course, a great physician caring for your patients, but also who you are outside of medicine. So I want to give you an opportunity to please share with the audience, the listeners, how we can get in touch with you. What will be the best way to stay connected, and what if you have any like parting words? Would love to hear those.
yes, absolutely. So I have a YouTube channel. So for people who are interested in all things weight related, it's Weight Medicine with Dr. Megan. So you can definitely find me there. I also have a website, weightmediциnemd.com, and I see patients in Massachusetts. I can be their weight medicine doctor and their weight loss coach. And also for people anywhere in the world, there's so many people who they have the medication, but they still really want to work on their exercise habits or their eating habits. And there's so much that goes along with,
Mhm.
not just being on the medication, but making the most of it. So I work with people all around the world doing that. So you can find out more all about that at my website.
Awesome. Very good. Well, thank you so much. This was great having a conversation with you, Dr. Megan. This was great. Thank you for sharing all the great nuggets on the GLPs. I know that there are a few new medications coming out soon, right? In the works. I've been getting questions about that. Do you have any insights to those when they will be coming out?
Yes, no, you're absolutely right. I'm very excited because I think two oral medications are going to come out next year. So
Hmm.
one of them is orforglipron,
Yeah.
and one of them is a higher dose of semaglutide. So because we have that as Rybelsus
Yeah,
now, but
Rebelsa.
it's not really effective for weight loss and it's not approved for weight loss. So hopefully it will get approved and have less side effects maybe next year. But there's definitely, I always tell people that weight medicine, we're at the very early stage of this. And in 10 years, it's going to look so completely different and we'll have so many options. So it's a very, very exciting time.
Yes, yeah, great, exciting time. And what I love the most about it is that we get to change the narrative around chronic lifestyle related diseases, right? Diabetes, hypertension, metabolic syndrome, all of that. It definitely helps to decrease that number because, again, obesity has taken an increase. And hopefully, with this new medication and lifestyle and everything, will just bring some healing to the world that we're in. So,
Yes, absolutely. And I think I love your message too, is it's such a can-do attitude of, yes, this is hard. Yes, this might be overwhelming, but there are these things like you can help yourself, right? And I think that's such a great message to teach people as you have so much more control than maybe you initially thought you did.
yes, very good. Well, to our listeners, there you have it. Thank you so much for hanging out with us to the very end. You've heard all the great information, and I want you to understand that yes, you've been inspired, but you'll still need to take the action steps, right? Do the action steps. It's not an all or nothing. Just ask the question, reach out to Dr. Megan. She does telemedicine, as she said, life coach. That is a necessity. It's not just about taking the medication, but how well you use it. So reach out, use her services. So I want you all to remember until next episode that you all deserve to live at your finest because you are worth it. All right. Take care, everyone. Thank you again, Dr. Garcia-Webb.
Thank you so much.
Bye.